I'm Dr. Sunil Shroff. I am the editor of the site called www.medindia.net, and you all have taken a subscription for the site to help you with a virtual integrated clinic. I'm here to tell you a little bit more about how to use this platform effectively for yourself and for your patients. I have a short presentation, and let me share my screen with you. So what is this integrated virtual clinic all about? How do we connect doctors with patients? This platform has been developed in compliance with the telemedicine practice guidelines, which was published by the Government of India. This is the guidelines which are gazetted and published in 2020. And what it does is it makes consultation through telemedicine by registered medical practitioners like yourself under the Indian Medical Council Act permissible, and this has been included in the Appendix 5 of the Chapter 3, which talks about Code of Conduct of Doctors. And a registered medical practitioner is defined as anybody under the Indian Medical Council Act, a person who is enrolled with State Medical Register or Indian Medical Register. And now the Indian Medical Council Act is called the National Medical Commission Act, as you know. Medindia provides you with one-stop solution to have teleconsultation, which, as I said earlier, is in compliance with the telemedicine guidelines of Government of India, and this is very important for you to know. It provides you technology solution to manage both teleconsultation and in-person consultation. And overall, it provides customized health and wellness information to your patients that is white labeled in your name. That's very important for you to remember, and I'll show you the examples of this. So what it overall does is creates efficiency for patient management, retention, and provides aftercare once they leave your consultation room. Because after they leave your consultation room, till they come back to you, they are not interacting with you, but this platform makes you do that. What Medindia does is captures all the essential details of the doctor when you first register. This is done because the telemedicine guidelines of Government of India requires it. And the guidelines says that technology platforms, mobile apps and websites should ensure that the consumer are consulting with RMPs who are registered, very important, with the Indian Medical Council or the State Medical Council. And technology platforms shall conduct due diligence before listing any RMP on its online platform. And platform must provide the name, qualification, registration number, contact details of every RMP listed on the platform. So this is why we capture all the details from you. When you're registered on Medindia, for that matter, when you're registered in any state, you can do cross-border consultation. And this question crops up many times. If I'm registered in the state of, let's say, Karnataka, can I do teleconsultation for a patient in Haryana? So you're allowed to do that under these guidelines. But cross-border overseas consultation is still an area. The guidelines don't say don't do it, but it doesn't define what are the do's and don'ts for those guidelines. As far as advertisement is concerned, generally advertisement has three components. To inform, this is allowed by the guidelines. To remind, like appointments, this is again allowed. What is not allowed is to persuade any patients to do teleconsultation. You should not solicit or advertise to give inducement for teleconsultations. This is what the guidelines say. So the guidelines also says that every medical practitioner who wishes to do practice of telemedicine should take an online course on practice of telemedicine. They should be familiar with the guidelines. That's very important before you conduct yourself in any telemedicine consultation. And this should be done within 3 years of the notification of guidelines. So the guidelines were notified in 2020. So by 2023, it is expected that everybody who practices telemedicine would have got certified. The guidelines itself talks about several elements of telemedicine consultation, and this includes the context of telemedicine consultation, identification of the doctor and the patient, mode of communication, the consent process, type of consultation, what patient evaluation you should do, and how you should manage the patients. For this, Medindia has tied up with Telemedicine Society, of India, which is a 20-year-old society, and the Telemedicine Society of India, runs an online course on telemedicine practice guidance for doctors. So you are welcome to take this course. There's a small cost to the course, and in fact, it is Medindia who has given an educational grant to Telemedicine Society of India to develop this online course. So it's a very effective course. It goes for 6 to 8 hours if you take it in one shot, and it covers all the areas of the practice guidelines. So I would encourage you to take this course, and this is available on Medindia as a premium member of Medindia. So now let's look at an integrated virtual clinic which we offer, and let us look at both the doctor's perspective and then we look at the patient's perspective for this. So the dilemma and challenges for a doctor includes that the engagement of patients usually in India is episodic. It ends when the consultation is over. Sometimes the chronic patients don't stick with the doctor for a very long time. They keep going from a doctor to doctor. We all know that. And many doctors don't have digital presence. So how do they engage the patients? And this is where the virtual clinic is a win-win situation that empowers both you and the patient. Medindia provides a verified homepage for you, and Medindia has a high domain authority, which means that once you publish a homepage on Medindia, you're likely to be found very easily on search engines. So this is a doctor who has registered with us, and we already search for him. He's right there on top on Medindia. The doctors, once they become members and they take this subscription, they get this kind of a login dashboard for themselves, for the patients, whether it's new patient or returning patient. And on their dashboard, they can literally control everything, including their profile. If they want to edit any information of their practice, they can do that. They can do, they can manage the online consultation, both the appointments, the payments, and so on. They can manage their physical consultation patients, their clinic appointments. Overall, depending on the specialty which you practice, you also get current, latest articles which are published on places like PubMed. So we curate PubMed for you and provide you with those articles. Along with that, we also give you the upcoming conferences in your area. So a very powerful dashboard you get to manage everything of your practice. What about patients' perspective? What do the patients get? So like a doctor, consumers also have their dilemmas and challenges. So what they feel is most of the information there is not necessarily relevant to their condition, which means they have to do multiple searches before they come to one location. And so they're not very sure how to manage their chronic condition on a regular basis. And as I said, they go to different sites for information of health information, for doctor consultation, for their self-care. So it's all fragmented out there. Whereas, if you want, Medindia provides trusted information in one place and helps to take action for the patient to improve their health. So if you look at the patient journey, it starts with awareness of a condition. Then they ask around how to see the doctor and set an appointment. Then they consult the doctor. And then the investigation takes place, treatment starts, and then they feel better. Medindia provides a personalized wellness information for self-care after they left the doctor, and this is white labeled to you. So Medindia completes the patient journey. It creates awareness about medical conditions. It finds the right specialist, books an appointment, facilitates consultation, and also plays a very important role in this post-care or self-care. Providing personalized wellness microsite, which is white labeled to the doctors. And this is why Medindia works like a health information buddy for all their members to take care of their entire journey as far as the patient is concerned. And this is what the patient gets: a personalized health topics, on what they're suffering from. If they're suffering from diabetes, they're going to get diabetes information. They select from almost 60 odd topics, which are common topics, to create their own homepage. As you see here on diabetes. And this is a white labeled page to the doctor. You see the doctor's photograph here, his name, health and wellness portal of the doctor. This is the consumer who is logged in, who is the patient of this doctor. and all patients will get these tips which are there, and then they'll get the information related to their health condition. It could be diabetes, it could be kidney health, it could be asthma, anything they want. We also provide, at the moment, COVID information to all the patients. We also provide articles, latest articles, the latest news, the health tips on that condition. Also provide them a small assessment for their knowledge if they wish to take that. The patient dashboard has multiple elements for many things they can do for a very small subscription. We have more than 3,000 inspirational health quotations and tips for the patients. And now we also start doing it in the Hindi. Hopefully we'll build more regional languages as we go forward. And we also provide them with reminders. And we do give e-tutorials, and I'll tell you a little bit about that. The health tutorials for chronic condition is curated by our expert panel. And this is for self-learning to understand the condition if your patient is suffering from better. And we provide short videos to the patients to learn about the condition. This is one such video on diabetes. We make a little disclaimer.
Mellitus is a condition that results in too much of blood sugar or high blood glucose levels in the blood. Insulin is a hormone produced by the pancreas that helps maintain normal blood glucose levels. Facts about diabetes. 422 milk, which is excessive thirst, polyphagia.
So this is a short video. Talks about what diabetes is. It's a 6-minute video for the patient.
It's contagious, isn't it?
So we have multiple such videos for your patients, for them to benefit, to understand the condition better, to manage their patients, manage their conditions better, so that whatever advice you give, the compliance will be better. That's the whole idea of these videos. So we have the short videos. Diabetes, since it's very common, we have 6 to 8 videos, and for lesser common conditions, we have a few less videos. But we have close to 400 to 500 such short tutorial videos for the patients. We also provide them with health risk assessment reports on various risk factors, on weight, on blood pressure, diabetes, and so on. They can also maintain a daily health diary of their health, jot on their notes. We provide them with an electronic health record to capture information of their maybe illness, allergies, medications they're taking, procedures, surgical procedures they've had, follow-up, lab test, and all that. In the lab test, they can also upload their reports. Image files can be uploaded into the EHR. And overall, this will track the health over a period of time, which the doctor can look at, the patient can look at, and know if somebody wants to lose weight and they want to track their weight, that can be captured, their BMI, and so on. You can set your targets. If you want to, let's say, schedule your weight, you can set your targets as well. We have calorie calculators, how much exercise you should do, and so on. As far as appointments are concerned, both in-person physical appointments are possible through this by the patients, or teleconsultations are possible. This is for in-person consultation. The doctor tells you what time they are. And we have an app for teleconsultation, which the patients can use. It's available on the Play Store also. It has a payment gateway. Give you the reminders for appointments and medication, as I said earlier. So this is a short presentation on how you can be empowered with Medindia to improve your practice, to improve efficiency, create a brand for yourself, give you the digital presence for a very low cost. This is what Medindia is all about. I hope you use the site. I hope you empower your patients. I hope you inform them. When you sign up with us, we give you a video in your own name, with a picture of yours. Use them on social media. We also provide you with this poster, which you can put up in your clinic and take out A4 printouts and give it to your patients to get a wellness program. So that's the whole idea of giving you a video and a poster. So you utilize all our services effectively, and I can tell you that not only enhance your practice, but also benefit a lot of patients. All the very best. Thank you very much.